Hands age just like the rest of our entire body does. We're losing volume. The hands become gaunt. They don't have the nice contour. They look hollowed out. There's excess skin because of the loss of volume of the hands. It's the same thing we experience in the face. Unfortunately, many ladies will go and do their facial rejuvenation, their facelifts, their skin care, whatever's appropriate, but they do nothing about the hands. And the hands are a dead giveaway. They have a youthful, rested face, but the hands give away their true age. You're not really going to change the veins, or you're not going to do a stripping of the veins like you might do in the legs, because circulation and the venous drainage of the hand is so important. You don't want to strip the veins. So in a young lady who has obvious veins, there's not really much you can do about it. I do not recommend stripping them. In an older person, the veins become obvious because of that loss of volume and that hollowness of the hands. So when you augment that hand, replace the lost volume, the veins become far less prominent and far less obvious. My choices for augmenting the hands are two. There are multiple choices and different people will use different fillers. I prefer to use Radius if I'm using a filler because the duration of the improvement is a little longer. And it's very straightforward, very simple procedure to do. So I will use the Radius because of longevity. My first choice is using the patient's own fat, doing liposculpture, just like we're doing fat transfers to the face for deep grooves between the nose and the mouth, or the hollowness under the eyes that some people get with age. We go down on the body, typically the abdomen or the thighs, take some fat and inject that in under the skin. That's a very straightforward procedure because there's a natural plane, a natural tissue depth there that it's all contiguous. So you really only have to make one stick, put all the fat in if that's what you're using, and then mobilize it and sculpt it and move it around to the appropriate locations. So it's a very straightforward procedure for the patient. The liposculpture will basically last as long as the fat will last, or better put, the liposculpture result will last as long as it took the hand to age, because that's what the patient has lost. They've lost fat in their hands, and that's why they have that hollow look. So how long did it take for that to dissipate? That's how long the newly placed fat will last, because it's your own tissue. There's no immune response to that material, obviously, and therefore it'll last for years.